Hey guys, it's Dr. Ariel Ourian. We are here for the first episode of our podcast. I feel like plastic surgery is so common. So many people are having plastic surgery, but it's still taboo. People don't want to talk about it, people want to keep it a secret. We're here to have a nice open discussion, dialogue about plastic surgery, about what it is to go under the knife, what it is to have surgery, what it is to recover in an open, safe environment, no judgment. We're here to just have fun, discuss things. I'm excited for our very first guest, Victoria.
Hi, I'm Victoria, aspiring human Barbie, and Dr. Orian's favorite patient.
But by far one of my favorite patients. All my
Thank you.
patients are my favorite, but you're by far one of my favorite patients. How long have we known each other for?
Oh my goodness. Well, pre-transition is when I first met you. I feel like that's been like 2 years ago, 3 years,
I think it's been probably over 3
maybe
or 4
four.
years
You've been there literally through everything. It's
throughout.
crazy.
Yeah.
And I'm happy to be here. A first guest. I feel so honored.
First guest,
I
of
did not know I
course.
was the first.
And I'm going to be really excited to talk about your transition. We're going to go through
Mhm.
kind of the surgeries we did together. Thank you for being so open. I
Yes.
know transgender surgery has unfortunately become very politicized,
Mhm.
but we're going to talk about your transition. And I appreciate the fact that you're here. And you know what? Show the community that here's what it's about.
Exactly.
Um, I met you when you were Hurricane Garrett.
Yes, I did. Well, we have like a mutual friend,
Yeah.
Queen of Hollywood,
The Queen of
Marcella.
Hollywood, Marcella.
Yes. So she like was initially how I found out about you because she had gotten some work done with you, and I loved her work. And then I was doing Snapchat shows as Hurricane Garrett, little boy. And then I went on Dr. Phil. You were in the audience.
I was there on Dr. Phil. He was a little rough and not what I
Yeah.
expected him to be, actually.
Definitely not. Is like the show even still like, are they filming anymore?
I don't
I feel
know.
like not.
There's a reason why I don't know. I don't watch the
Exactly.
guy.
Exactly. But yeah, no, like it's I always knew I wanted to transition, but I'm very like all or nothing. So like I knew I needed to save to like because I've been this year we've been together like so much. You've done literally
A
head to
lot.
toe on me.
Yeah.
And we're still not done.
We're still not done. We got a couple little tweaks to make. Just a
Yeah.
couple more tweaks.
No one look at my nose. And like there's so many cameras. Like what should I look at? But that'll be fixed in like
That'll be
a
fixed next
month.
month, I
Yeah.
think.
Hmm.
Right?
I'm excited. But yeah. Sorry, I'm like all over the place.
Yeah, no, it's okay. We're here to just
Yeah.
shoot the shit, have
Mm.
fun. Tell me, how did you come up with the name Hurricane Garrett? I know this is going a little bit back in time,
Oh
but
my goodness. I honestly have no idea. That's like it's not a fun story. I was just trying to think of a name. Um, yeah, Hurricane Garrett. I don't know.
Hurricane Garrett.
There's literally nothing. Yeah.
So tell me, when did you feel like when did you start to transition? When did you come out? Was it difficult to come out?
Mhm.
Tell us about your journey in that.
Yeah, I grew up in the Midwest in Indiana slash like Tennessee. So like my I didn't honestly growing up, I didn't even know like what transgender was. I always knew I was never confident in my body. Um, and yeah, so when I moved to LA, like, I started realizing what it was and I was like, oh my God, like I identify as this, like this is truly like who I'm supposed to be. Um, and again, like I'm all or nothing. So to look the way I felt like it's gonna be a lot of money. So I had to just like really work and do like a lot of TV. That was like, social media to earn my money. But then it was hard to be on camera because I wasn't seeing who I felt like I was.
Right.
So then that was a whole other thing. But finally at a place to where I'm like, you know what? I'm ready. Let's do it. And we've done my boobs this year. We've done hip implants, butt implants. We just shaved my huge brow bone down. My brow bone is so flat now. And
Our beautiful lip lift.
oh, the lip lift. Yes. I love it. Now I want veneers because now I want you to see my teeth even more. Like, it's amazing.
So let's talk about, we started with breast augmentation.
Mhm.
We used high profile implants, gave you the
Yeah.
beautiful cleavage that you wanted. I think we chose the perfect size.
I do too.
The next surgery we did was butt implants,
Mhm.
which a lot of surgeons don't do. I'm happy you came to me, and it's something
Yes.
that we did together.
Mhm.
And the hip implants was certainly something that not a lot of people do.
Mm-mm.
They actually don't even make hip implants.
Yeah.
So I had to custom design this hip implant that we put
Yeah.
in, and it came out phenomenal.
They looks so good. It's crazy because when I first met you, it was when I was filming for like a Snapchat show, and all I wanted was a butt. Like that,
I
I have
remember.
so many consultations about butt implants, and but then we ended up doing my boobs first, um, and those turned out amazing. I was like, you know what, we have to do the butt.
We
So
have to do the butt. And
I have
now,
big juicy
uh,
booty.
I mean, you really have a beautiful hourglass. The
Mhm,
combination of the breasts, the hips, the butt has
mhm.
changed your body. It looks unbelievable. I mean, I'm sure you're walking down Bedford Drive to come here,
Oh yeah.
turning heads.
Mhm. I have to get like tint on my like windows now in my car because everyone like stares and like I
I
love it.
love
I
it.
love
I
the
love to hear
attention. Yeah.
that.
But I truly like love that you have like really been like you know what is gonna look good on my body because officially or initially like I feel like if I would have went to another surgeon the way I was, I would have been so bimbofied. I would have just went ginormous with everything, and I'm so glad that you like reeled me in. We're like, no, this is what's gonna look good. Cause like I love like I look Barbie not bimbo, like very like
Right.
conservative supermodel, and yeah,
Turning heads,
yeah,
supermodel. Yeah. I
mhm,
mean, the most important thing is before we even get into that is safety.
mhm,
And we kept you safe.
yeah,
We didn't do all the surgeries at once. We
mhm,
split it up.
yeah,
And most importantly, we used the W path criteria, the World
mhm,
Professional Association for Transgender Health.
okay,
And we do this right.
mhm,
You went to the therapist, you talked to the therapist, and we
yeah,
made sure everything, we checked all of our boxes,
yeah,
and it did.
yeah,
And we started this journey together,
mhm,
and here we are now. So let's talk about the
mhm,
very first gender affirming surgery you had.
yeah.
What made you pull the trigger? What made you say, okay, you know what?
Mhm.
Let's do it.
I was tired of having a flat chest. I wanted some nice tits, so
You got some
that's
nice
really it.
tits.
Yeah.
Yeah.
Well, I always like I grew up in the South, like I said, so like I've always loved blondes, but like Dolly Parton and like just love big titted blonde women, if that makes sense. So yeah.
So then what made you pull the trigger? You said,
Mhm,
this is what I feel. I
mhm,
feel like I'm a woman. That
mhm,
doesn't match what I feel.
mhm.
I want to feel on the outside like I do on the inside.
Yeah.
And that made the decision, okay, let's go down this path.
Mhm.
So that was the first surgery. How did you feel after waking up? You're seeing your breasts,
Yeah.
which is a huge change. You see it; it's an immediate change. It's not like you have
Yeah.
to wait. Liposuction, you have to wait for the swelling to go down, all that stuff. But this is
Mhm.
an immediate change that you see your breasts. Granted,
Yeah.
they come up high and tight, but
Yeah.
what did you feel when you woke up?
I felt amazing, honestly. Like I was so excited. I don't think I really was nervous. I feel like a lot of people get nervous for plastic surgery, but for me, I was just like so ready to get it done. But yeah, I felt so good because I feel like boobs are something that really just makes like a woman a woman. So like I feel like that was like a good first surgery. I feel like for any other like trans girls out there watching this, I feel like definitely like the boobs and, like, the hip implants, those were the 2 surgeries that really, like, eliminated my dysphoria, I feel like, the most.
Right.
Mhm,
So it's really important that you brought up other women. It's
mhm,
again, this topic has unfortunately become so politicized where this is a personal decision. No
mhm.
one should tell you what you should be doing with your body.
Yeah,
And what are your thoughts on what you're hearing in the media right now?
mhm.
What are your thoughts on this?
Yeah, I think it's, unfortunate that I feel like trans people are just really misunderstood. I do think that personally, I do am glad I waited until I was 18 to get surgeries. I do think that I feel like whenever like you start talking about like sexual reassignment surgery for trans individuals like under 18, I do kind of think that's not I think you need to be over 18 for that for sure. Um but I do think that like plastic surgery, I mean, is like a trans girl's like best friend because you're the one that's helping us feel like we feel like on the inside. On
Right. And
the
making
outside.
you feel like that on the outside. And that's the beauty of plastic surgery. That's kind of
Yeah.
all the procedures we do is people want to feel
Mhm.
on the outside like they do on the inside.
Yeah.
So I'm happy we're talking about this. This is a
Mhm.
time where it's become very political. It's become,
Mhm.
I can only imagine how difficult it is for other transgender patients to
Mhm.
come out, given there's
Mhm.
so much stigma around it now.
Yeah.
So it's nice having you here,
Mhm.
and you can, I know you're super open about this. You can be a
Mhm.
resource to other people if they can reach out to you and say, hey,
Mhm.
Victoria, help me,
Mhm.
I'm feeling this or that.
Yeah.
What can I do? Who can I turn to? And
Yeah.
there's you.
Yeah. No, I think it's really important too because I have been fortunate that my transition journey has been pretty easy. You know, I've been able to get pretty much like as soon as I wanted a surgery, I've been able to get it. But I couldn't imagine if I wasn't in this position. Like, I feel for all the trans girls out there that, like, you know, don't have the means to get surgery and stuff like that. But definitely, like, try to push through like insurance too. Like,
Yeah.
I think that is something that a lot of girls don't know that they can do.
Yeah, and that's important to talk about, that
Mhm.
insurance will cover
Mhm.
some of these procedures depending on the plan. You know, we had to jump through some hoops with your case,
Oh,
and
exactly.
we fought tooth and nail.
Yeah.
We had patient advocates. I
Mhm.
advocated for you, and
Yes.
we made it happen.
Mhm.
Uh, every policy is different. There are actually limitations in your policy that we had to work through. So
Yeah.
it's a challenge. It's
Exactly.
really a challenge, but you know, our office, as you know, is always open and trying to
Mhm.
help people, and we will figure it out.
Yeah.
We want there to be as least stress for you as
Mhm.
possible. You're already dealing through a lot. Let us
Mhm.
deal with all the bullshit
Mhm.
insurance stuff.
Yeah.
We will get a patient advocate.
Yeah.
We'll make it happen for you.
And you've been so good with that.
Thank you.
Like, I mean, I've only went to you for all my surgeries,
Yeah.
but I've never had any other like thought to like go somewhere else because
Thank
I
you.
felt really taken care of. And it's been very stress free.
Yeah, and like let's talk about the next steps. We're
Mhm.
doing next month, I believe, we're doing
Mhm.
two more surgeries.
Yes.
Tell us what we're doing.
We're doing my nose and my Adam's apple. Well, we're shaving my Adam's apple, then reconstructing this nose to look like a Barbie on a nice ski slope. Beautiful tip.
And also to you know, you have some breathing issues, so that's going to help with your breathing, so you have a functional
Exactly.
aspect of it.
Exactly.
And then the Adam's apple,
Mhm.
it's a misnomer. It's called a larynx shave. It's actually the thyroid cartilage that we're going to shave down.
Okay.
It's an interesting procedure.
Yeah.
It's actually I'm going to have another surgeon come in and put a camera, a scope down
Yeah.
your throat so we can see your vocal cords.
Oh, that I see. I didn't know that.
I'm going to be on the outside.
Mhm.
I'm going to put a little needle inside to see where we are so I can see on the camera,
Yeah.
so we can not damage your vocal
Yeah, yeah,
cords.
yeah.
So it's a two-man
Crazy.
operation.
Oh my gosh. See, I didn't know that. That's crazy.
So now you know I'm going to have a colleague with me, and then we'll probably start with that, and then move up to the nose.
Yeah.
It's-
What I have a question for you.
Yeah.
What's been like out of everything I've done, what was like the one surgery that like stressed you out the most or like you felt like I don't know the word, but like the most difficult, I guess.
Easy. So is the hip implants.
The hips. Yeah. That's what I thought.
I use a couple of companies for implants,
Yeah.
which are the implants we use for butts and hips are different than breast implants.
Yeah.
And there's only a limited number of companies that make these.
Yeah.
They did not make, or they do not make hip implants. They're just
Yeah.
not made.
Yeah.
So I ordered a special implant that I was able to carve on the table
Yeah.
in the operating room,
Yeah.
seeing what fit.
Yeah.
So that one kind of, you know, surgeons are humans.
Yeah. No, that's crazy because when before we started doing like my lower half, like I was always wearing like pads and
I
like
remember those
it's
pads.
so crazy to like not have to wear those anymore.
Yeah.
Like it truly is just like made me feel so good.
And you know what's crazy is I remember you came in for your pre-op appointment for your hip implants. You actually gave me one of those pads. I said, listen, give me one of these.
Yes.
It's going to help me design the implant that we're going to use.
Yes.
Yeah, I remember those pads.
like,
I had it in
drew
my
on it.
office.
Yeah.
I was like drawing stuff. How can we do this? I'm looking through the catalog. What could work as a hip implant?
Yes.
And we made it through a tiny little incision up above that you can barely see.
Yep.
Your butt implants went in through two separate incisions, hidden in the crease so no one can see it.
I know that's what's so good. It's like when I have like a thong on or like a bikini, like you can't see my incisions or like scars because it's like placed exactly like where it needs to be, which is good.
So that was a fun surgery, and you know I'm doing more and more of these. That surgery was great for you because you have no fat.
I have a zero.
You have zero fat.
Yeah.
So in other patients who I can do liposuction and harvest that fat,
Yeah.
we can do fat transfer. We can do a BBL.
Yeah.
We can do fat grafting to the hip dips. But
Exactly.
you were in a candidate, and we talked
Yeah.
about it so much. Like, okay, Victoria, you have no fat.
Yeah.
Okay, can we do Sculptra? Sculptra, you're going to need a shit ton of vials, which is
crazy.
cost prohibitive.
Yeah.
So then we moved to the hip implant, and that's kind of what we did, and it was kind of like the right choice, I think, for you.
100%. And like I like that it's like, I mean, I know I could take it out, not that I want to, but like it's permanent. Like I like, because I feel like, right with like BBLs, like the fat can like, girls will get it, they're happy, and then kind of over time, it like, the fat dies or something?
Yeah,
Or
so
like,
you can, so the fat you put in a BBL,
yeah.
40% of that fat will die. It's
Oh,
an
see, that's crazy.
40% will die. So I always overfill patients and
Yeah.
I tell them, hey, don't freak out. You're going to wake up with a little bit
Hmm.
bigger than you expected, knowing that
Yeah.
40% of it will die.
Yeah.
But hip implants, you know what it's going to look like. What you see
Exactly.
is kind of what you get, especially
Yeah.
after the swelling goes down, you know
Mhm.
what you're going to get.
Exactly. And they're so like not not comfortable. Like
Squishy, feels
yes.
real.
Like I can't even tell they're inside of me. Like it's crazy. And the butt implants, I always wondered like what it was gonna be like sitting down. But like
Yeah,
you
I
don't
remember we
even
talked about it.
sit on the implant. It like almost goes up if that makes sense. Like I don't know how to explain
Yeah,
it.
so the way I put in implants is
Mhm,
my technique
mhm.
is a special technique. I put the implant in uh, kind of underneath the subcutaneous tissues and the fat.
Yeah.
Then I transition into the muscle. The muscle is a hammock,
Okay.
the gluteus muscle, to prevent it from dropping. You see a lot of these complications with
Mhm.
patients walking around with really weird shaped butts after the
Yeah.
implants. And I've had patients come to me, I've had to revise them
Yeah.
from other surgeons don't have a lot of experience in doing butt implants.
Yeah. It's perky. It's definitely
It's
not
perky.
dropping.
It's not dropping.
Yes,
We have
it's
pictures of that on my Instagram.
yes. Go check it
Go
out.
check it out.
Yes.
Cool. So tell us a little bit about your childhood growing up in
Mhm.
Indiana. How did you
Oof.
end up in Beverly Hills
I don't know,
and
like
West Hollywood? You live in West Hollywood.
yeah, I move so much. I'm never like I'm always just trying to like Barbietize my life. New
I
apartment, new
know.
cars, like new body. But no, yeah, I grew up in Indiana and like Tennessee, and it was just like there was like nothing going on. I think like the whole Barbie aesthetic was like escapism for me. Like I had a pink car in high school. Like I've always
I think
just
I've seen that
loved,
picture.
yeah, I've always just loved that I don't know, just idea of like a perfect life. And I love being on camera. So I feel like LA was the place to be for
Natural
that.
place. And you moved
Yeah.
down here, you were alone. You didn't have any family or
The
anything.
day I turned 18, I like got my dog and I just drove in my
You drove
car.
here.
Oh
How many
yeah.
hours did that take you?
I think it was like made it in like 3 days because I like
Wow.
stopped and slept.
And you
But
were alone. You had no one
oh
here.
yeah, no.
Got your apartment,
Mhm.
started a life here on your own. That's
All
awesome.
myself. I didn't even like I don't even really have a relationship with my family now, unfortunately, due to like me transitioning. So that can kind of show you like my environment growing up.
Yeah.
Like it was bad. Like I couldn't even wear makeup. Like I remember I like always lied to my mom that like I was part of all these like clubs before school. So she dropped me off early. I'd do my makeup in the bathroom. And then as soon as the bell would ring at the end of the day, like wipe it off and like go home. Yeah.
Kids are smoking marijuana in the bathroom and you're
Yeah.
there doing your
100%.
doing
My
your makeup.
makeup.
Your
I'm like,
makeup.
I tell my mom that I was like, like you could have had it so much worse, but you chose to, get mad about the makeup or whatever.
So it must be hard that you don't really do you not talk to your parents anymore or
I'm an only child, so like I've kind of used to being alone. Like that sounds really depressing, but like I've just learned to be independent. So
yeah.
like I've done what I've needed to do.
Yeah, you're just so confident now,
Mhm.
and I've seen you kind of over the years that we've known each other. It's kind of
Yeah.
changed, and yeah, I think West LA. Here's where
Mhm.
we are. Is where there are so many LGBTQ
Mhm.
uh, people in our population in West Hollywood, especially. So
Oh
it's
yeah.
great that this. I'm hoping you feel more supported here,
100%.
and yeah. So that was a great move, West Hollywood.
Yeah. I'm so happy to be here. I'm happy that I found you. Like it's all worked out so well.
It all
And
worked
my
out.
transition is going very smoothly. So
So looking back at all these
yeah.
procedures you've had so far, what was
Mhm.
the most painful, difficult recovery?
I definitely know that. Usually my brow bone shave. That
Yeah.
was so crazy. No pain medicine, no sleep,
Yeah.
literally nothing was helping, but it turned out great. I mean,
Yeah.
obviously you shaved down my skull. Like, what did
Yeah.
I
Shave down your
expect?
skull.
Yeah, but that was crazy. Like,
So you want to know the details of how it was done? Did
I
I
do.
mean, I
I'm
went through a lot
curious.
of, you have your incision kind of hidden in the hairline, which you
Yeah.
can see, you can barely see, and it
Oh
gets
yeah.
better and better as time goes
Oh yeah.
on.
We're only like 7 weeks, 8 weeks post op.
Yeah. It's only a
So
couple months.
yeah.
So the incision is made,
Mhm.
your your forehead tissues are reflected
Yeah.
down so I can see the brow bone,
Yeah.
and I shaved it down
That's so
with a burr, with a
Mhm.
pineapple burr,
Oh
shave it
my
down
gosh.
until, keep looking at the contour, make sure
Mhm.
it's beautiful, feminine, that ridge that you had that you hated.
Oh
You said you saw in different lights. You're trying
yeah.
to,
Mhm.
shave that down, and then
Yeah.
ultimately you brought that back up. And in the process, I took a little bit of skin out to actually bring your brows up for a
Oh
more
yeah.
feminine brow.
I love it. It definitely like there's less shadow around my eye. It
Uh-huh.
just really made me I feel like look more youthful. I'm 24. Hopefully I can pass this 21. And then it just like yeah, like when light hits me now, it just the camera like reflects differently. Like it just looks more feminine.
Right. And you're
So
always on camera, always
mhm.
doing new projects and
Yes.
new
Well, actually, this is the first time I've been on camera since
since.
transitioning. Because
Wow.
again, like I never like seeing myself on camera. So now I'm like at a place where I feel good. Even better after the nose. That's gonna be like everything will be
We'll have to bring you back for
Oh
another
yeah,
podcast after the
100%.
nose and after
Yeah,
the Adam's apple.
I'm so excited.
What was the easiest procedure you went through?
The easiest, probably the boobs.
The boobs.
I would
Okay.
say that, or yeah, probably the boobs. Maybe the hips actually, because you guys, he did so good, but I accidentally popped a stitch. That was my fault. I
That's fine.
felt too good, too quick. Things happened in the bedroom and I popped the
Oh
stitch
boy.
open. Yeah.
Oh boy.
So,
But it healed
oh yeah, it
appropriately.
feels
We're
great.
good.
Hmm.
No complications.
Yeah, it
So
was my fault, but
it's okay.
but
So
that was
that's
easy because yeah, I felt really good like quickly. I was like, oh, I'm good. And then no,
and then so easiest was probably probably hips. Okay.
almost gave you a heart attack.
You almost gave me a heart attack.
Mhm.
I am, you know me by now.
Yeah.
I am like my patients are like family in my life. I
Oh
got to
yeah,
make
yeah.
sure stuff heals.
Hmm.
We don't have any complications. I
Oh
always
yeah.
joke or not even joke that
Mhm.
complications are kind of pierce a hole in my soul.
Yeah.
So this isn't just a job. I don't go home and like, hey, okay,
Yeah.
obviously go home play with my kids,
Hmm.
but I think about my patients when
Yeah.
things. This is surgery. Things can go
Exactly.
wrong.
Oh yeah, no, you were like texting me like you're like, I don't care what time it is, if something's wrong, text me. Like I've texted you like 2 in the morning before, like and you've answered like you've been great.
Yeah,
So
so I sleep with the phone next to my head.
hmm.
I'm sure my wife doesn't like that, but yeah, I mean, this is why my patients have my numbers
Yeah.
because I want to know. I don't want to find out the next morning.
Yeah.
I don't want to find out when things progress. I want to know like immediately, and this is the
Yeah.
exact reason because you're having surgery. You're
Hmm.
trusting me to operate on you,
Yeah.
and it's my responsibility to take
Hmm.
care of you.
Yeah.
And I see my patients for a year after.
Yeah.
I mean, it's gonna be longer and longer.
Yeah.
You
I
become like the
love it.
Ourian family.
I love it. I'm so happy. Like I honestly just like can't believe like I've gotten to this point because we've taken our time, but at the same time we've really done all these surgeries and we haven't even hit the 1 year mark for my boobs yet.
Right.
So it's like it's just like I'm happy that I'm here. Like it's crazy that I've healed and I'm checking all the surgeries off.
Right. Tell us like about your personal life in
Hmm.
terms of now going out,
Hmm.
now that you have transitioned and really
Yeah.
feel like a woman on
Hmm.
the outside and in the inside. How do
Yeah.
you feel when you go out and where do you like to hang out? What do you like to do?
Oh, I'm like everywhere, like all the clubs here, but like it's weird because it's like, well, not weird, it makes sense, but I just have so much more respect for myself. I feel like dating, like, um, I put so much effort into my body and time and money, and I'm not just, letting any guy talk to me now and stuff like that. Like it's been super. I like being like a doll. Like you can look, you can't
You
touch.
can't touch.
Yeah.
You can't touch.
But no, it's been great. Like, I'm just being treated a lot differently. Like every surgery I get, I feel like I'm just being treated like much better, and
I think it's
it's
really what you're
great.
feeling on the inside. That's really your self
100%.
confidence and now feeling
Mhm.
like you feel on the inside. So
Exactly.
that is awesome.
Yeah. So definitely like going out, it's been great. And I used to rely like so much on like having like a really good outfit to like make me feel good. But now that I have like a body, it's like, I mean, this just like a Skims like tight, simple dress, and like
Done.
I feel so
Out
good
the
in it.
door. Yeah.
Yeah.
And no more of the padding, the butt
No,
padding.
that was so
That's
bad.
that's I threw it away. I told you after we designed your hip implants, they
Yes.
went in the garbage.
Please
They were
throw them away.
gone.
Well, it's crazy because before I got like the hip and butt implants, like I'd wear the padding to the club. Like someone would go touch up on me, like, what is this? And
What
then
is
one
going
time,
on?
like my hip implants, like on the dance floor, like fully were falling down. I was like, this is so embarrassing. And you're drunk, so you don't realize they're sliding down. I get home like, wow.
So you're kind of like in the peak of your youth. You're enjoying life.
Yes,
What are your
100%.
where do you see yourself in 5 years from now?
I definitely like want to like really tap into modeling now. Like I feel like obviously I'm sitting down, but when I stand up, like I really do have like a model figure. Like it's very curvy, but like skinny curvy. And so that's definitely like I want to pursue that a lot more. Get back on camera. Like I love content creation. So I want
Yeah.
to start my own podcast. So
Yeah.
like
Oh,
I'll
you
tap
got to
you
invite
on.
me as a guest. I'll be
Yes.
there.
Yeah, just I love being on camera. So anything on camera.
So, Victoria, you've
Hmm.
been featured in the press a lot
Hmm.
throughout the years.
Yeah.
And what's the biggest misconception
Mhm.
that has been portrayed? And,
Mm.
knowing you, it's kind of different than what I read, but what do you feel?
Yeah. Biggest misconception. Probably that like people think I'm just like really dumb. Like I'm really not. Like I'm or people think like I am the way I am because of like I've had a ton of trauma like growing up. Like that's really not true. Like aside like the whole transitioning, like I grew up great. Like so yeah, like I'm smart. I think I don't know.
It's like if there's that
Yeah.
misconception that
Mhm.
kind of that blonde bimbo, and
Yeah.
yeah, that's certainly not the case. When I've
Mhm.
known you, we've
Yeah.
had a lot of great conversations outside of medicine, obviously.
Yeah.
So that's kind of
I got like a lot of criticism for stuff I was doing, but it was warranted. Like I was doing stuff for attention. Like obviously, like when I went on Botched and like Dr. Phil, I was like gluing my lip
I
with
remember
nail glue,
that.
pushing it up because like I wanted to look like Botched. Like, I was like 18, 19, like anything for attention. But now I'm like trying to class it up a little bit.
Classy.
Yeah.
Tell us about Dr. Nassif when you're on Botch. What
Oh
do they tell
yeah.
you?
Well, I think they kind of saw through the lies a little bit. But yeah, like it was like fun. I grew up watching the show, but I wasn't actually botched. Like I had no surgeries. I really don't even know how they let me on the show. But I was like sucking on a Coke bottle before I like went on there to really like blow up my lips, and then I was gluing them. And then I got Dr. Phil. Like I didn't have a ton of like screen time because I was so afraid to talk because I didn't want my lip to pop down. So I was like, yeah, that was the whole don't really recognize that Hurricane Garrett anymore.
Yeah.
Um, but yeah, no, I love being like a little blonde, innocent Barbie, but I am like smart and I am very I love money. So that's like, money's like the only thing that's really important to me. So
So let's talk about some of the sugar daddies you've had.
yes. You've seen I think maybe three sugar daddies in rotation for these surgeries, which it's like thank you for being like so good about that. Like it was crazy bringing them in because I don't know, it's just a lot to like have like a sugar daddy.
And they've been really cool.
Mhm.
Just having like conversations, and they're really like cool guys you're hanging out
Yeah.
with. And
Yeah.
it's like, it felt just very natural, the natural chemistry.
Mhm.
I enjoyed having them, hanging out with them.
Yeah.
We had some work done on them.
Yes, exactly. No, it's like so fun that like I'm able to bring like my sugar daddies in and like the dynamic has been good because
Yeah.
in return that's helped them want to like pay for my surgeries because like okay like you're in good hands because they do care about me at the end of the day. Like I feel like being like a sugar baby, that's a misconception. I feel like is that like I don't know that they think it's just like all like sex. Like I don't know what I'm allowed to say on this podcast,
You
but
can,
like
this is the great thing. This is our podcast. This is
yeah.
my podcast. You can say whatever
Yeah,
you want.
perfect. Because it's really not like that. Like, I mean, these are really, really old men. So, like, the bedroom is really not so much like a big factor in the relationship. They love just making me feel good
And
and
company, and feeling, loved,
yeah,
and companionship.
yeah,
And I can see the dynamic you had is
mhm,
more like again, just like a life companion and a friend.
exactly,
And not, like you said, not just the bedroom. It's more like having someone to care about, and
exactly.
having, some of these sugar daddies
Mhm,
didn't necessarily have a lot of family, and
no,
they may have felt alone,
yeah,
and you're providing them with that love and
yeah.
that attention that they may not have had necessarily.
Yeah. And also just for instance, like I have like one sugar daddy now because I lucked out
And
with
he's
this
mega
one.
cool. He
Yes.
is mega cool.
But he like has like no family left.
Yeah,
And
he
so
told me.
like it's sad because that's one thing like LA has kind of made me jaded, but growing up in Indiana, like I have a good heart. So like I could be using him a lot more than I am, but
And
I have a
you're
good
not. You're
heart,
treating him with
so
such respect. And,
yeah.
he just went through something really difficult
Mhm.
with the Palisades fire.
Yeah, his house burned down.
And, if he didn't have anybody with him to help him
Mhm.
mentally through that, that would have been really difficult. And you've been there for him. You're
Exactly.
helping him move.
Yes.
You're,
I was late today to this podcast because I had to help him move.
it's okay. I was
Yeah,
just,
yeah.
in my office drinking coffee. But,
I feel bad.
so yeah, you've been helping him move even.
Yeah.
And, I can only imagine how someone can get through the Palisades fire like that, lose their home, lose everything that they have,
Yeah.
and not have any emotional support from another person. So that was really
Exactly.
beautiful.
Yeah, and it's like he was going through that, and like we had already had like a surgery, like it was my face, and he was still like, oh, like I'll pay for it, and that meant a lot to me. I'm like, wow, like your life really is like going upside down, and you're still helping me pay for my surgeries.
Yeah.
So
So,
yeah,
I mean, the stuff we were able to get it covered by insurance, we did, but
yeah,
your policy was a little bit difficult.
yeah, yeah.
We fought so much. I've never had to fight so much for a policy.
Mhm.
Actually, once before, I take that back.
Yeah, yeah,
And doing a peer to peer. So sometimes you actually have to get another doctor on the phone who doesn't understand transgender surgery and gender affirming surgery.
yeah.
As you already know, I did
Yeah.
a fellowship at Cedar Sinai
Mhm.
with one of the main focuses was transgender surgery. And we understand the process that goes into that.
Yeah.
And I'm trying to explain these to the other surgeon, or sometimes it's not a surgeon at peer to peer. Anthem Blue Cross or
Mhm.
United Healthcare has different ways that they approve surgery. And then if they deny it, then you go through this thing called peer to peer, where
Oh.
there's another physician on the other line and you explain to them, hey, here's what I'm doing. Here's the justification. Here's what it means.
Yeah. I
So
see. I didn't know that.
there's a lot that went into it.
Well,
I
I've heard
talked,
you mention like peer to peer, but I didn't really know what that meant.
yeah, because, and it's not, unfortunately, it's not something that's, I hope it's becoming more common. They talk about this and teach this in medical school. It's certainly become a part of the American Board of Plastic Surgery
Yeah.
on exams,
Okay.
on testing, and things like that. It's
Yeah.
become part of the curriculum now. And it's
Oh, that's
important to know that because, again, you're training the next generation. They have to be able to know how to do this. And most importantly, the most important thing is how to do it safely,
Yeah.
thoughtfully. Use WPATH, the World Professional Association for Transgender Health.
Yeah.
Do it safely. And I'm happy to see that at least it's being taught in plastic surgery school now.
Sure.
But the other physicians in medical school who are being trained, not necessarily. So I'm hoping that there's some curriculum change.
Yeah.
And, I would actually love to be, we live here in LA where we have two major medical schools here. We have UCLA, USC.
Yeah.
And actually Kaiser opened up their own medical school. I would love to, reach out and say, hey, can I contribute to your curriculum?
That would be amazing.
And
Did you always know you wanted to be a plastic surgeon?
oh, great question. Great question. So I always knew I wanted to be a surgeon,
Yeah.
period.
Yeah.
There's, the first decision is medicine versus surgery.
Okay.
Surgery was easy. So I went into general surgery wanting to do trauma surgery. And I did it after a while and it took a toll on me
I can
mentally and
imagine.
emotionally, just seeing so many people die, kids are dying, coming to the trauma bay. And then there was so much I can handle.
Yeah.
And, I hung out during general surgery with some of the plastic surgeons who were doing the reconstruction on these trauma patients.
Yeah.
And I'm like, hey, this is really cool. You just changed this person's life.
Yeah.
And then I start to learn more about plastic surgery. Okay, let me hang out with the plastic surgeons doing breast reconstruction.
Yeah.
I'm like, hey, this is really cool.
That's
And then I hung out with some of the plastic surgeons in the community doing cosmetic surgery. And then I spent some time during my training at Sloan Kettering in New York.
okay.
And that was like, okay, seal the
Oh,
deal.
I love that.
Seal the deal. So I applied to plastic surgery school after I did 5 years of general surgery. And then did my 3 years of plastic surgery. And I wanted to get the best of the best training.
Oh,
I wanted the best.
because you've done so good.
I wanted the best. So I went to Texas Medical Center, Houston Methodist in Texas Medical Center, largest medical center in the world.
That's cool.
Their children's hospital, Texas Children's Hospital, is the largest in the world or largest in the U.S. I don't know, but that was like the most inspiring 3 years of my life because you're in the largest medical center world.
Yeah.
Any procedure you want to become an expert in, there's someone there doing that procedure.
Yeah.
And one of my attendings who trained me, Dr. Shui Din,
Okay.
he used to do vaginoplasty. So he used to do male to female bottom surgery.
Yeah.
and I learned a lot from him.
Yeah.
And yeah, I'm fortunate that this was my training, and this is kind
So
of, it
cool.
shaped me to who I am
Yeah.
today,
Yeah.
kind of the path of how I got here. But I couldn't be more happy.
Did you know you wanted to have your practice in Beverly Hills, like when you were going through all, your school and training and
Yeah,
everything?
the I was born and raised in LA, not in
Yeah.
Beverly Hills, in the San Fernando Valley, right
Yeah.
across the hill.
Oh, cool.
And my wife is from LA, so there was no question we're coming back.
Yeah.
And everybody said to me, "Oh my God, it's so competitive. How are you going to survive there?" Here we are, just a few years after, and thank God, beautiful office.
Yeah, well, I was
Patient.
gonna say that too. Like, my body's been on a transition, but like, I feel like your practice, like, obviously you were well established before I even met you, but like, your office has changed and your
Exploded.
practice has expanded since I've even known you.
Right. So it was actually fun designing this office.
It turned out so good.
I went to the stone yard and I picked this exact
Oh,
piece.
that's
So they have different.
cool.
This is the crystal. This is natural quartz. And
Oh
then
my
to
gosh.
choose the slabs, even I had a designer with me, Stephen Cordray. Shout out to Stephen Cordray at the Cordray Collection.
Yes.
And we did this. It took months. We would go to the stone yard. Even the wallpaper, everything you see here was handpicked.
See, I didn't know that, and that makes it even like better because that's so cool.
Yeah, even this sculpture.
I love
We
that.
had this custom made.
Oh my
So the process was a lot of fun. And a lot of people, initially try to discourage me. It's going to be hard to do this on your own. And you know what? There are patients for everybody.
Yeah.
And I'm really lucky. We have a really collegial community here in Beverly Hills. Everybody thinks it's catty and competitive. No, look at the building. Well, I'm obviously on the street. Everybody has to
Yeah.
pass by me before they
Yeah.
get to the plastic surgeon's
Yeah.
office in this building.
Yeah.
But there are probably around 20 to 30 plastic surgeons in this building.
Yeah.
I have a relationship with most of them where we're collegial, we're friends.
Yeah.
We each invite each other to our holiday parties, and it's we see each other, we run cases by each other. So
Yeah.
it's nice that it's not really what people think it is.
It's like a community.
It's a
kinda.
community.
Yeah.
Sure, certain surgeons are busier than others,
Yeah.
but there's patients for everybody
You
here.
need to set me up on a date with one of your plastic surgeon friends.
Let me think. Let me think. There are quite a few bachelor plastic surgeons living the life.
I don't really cook, but I can clean, and I'm really submissive. So. But no, I actually wanted to be a plastic surgeon like growing up, but then I realized like I think I just want to marry a plastic surgeon and get it done on me. So, but
So,
yeah,
yeah,
I love plastic surgery and just like medical or anatomy. I think is like the
Yeah, that was
greatest.
my favorite class in medical school was actually anatomy, where
Yeah.
we had 20 cadavers
Oh, I love that.
in a huge room.
Yeah.
Initially, their faces were covered, and I used to spend so much time in this anatomy lab, like going through stuff. I'm like, this is so cool.
That's so cool.
And I remember we used to have exams on the cadavers. So,
Yeah.
20 cadavers, some are male, some are female.
Yeah.
And we used to have our exams on Monday mornings.
Uh-huh.
So throughout the weekend, we're there. Saturday night, the lab used to close
Yeah.
on Sunday at noon
Okay.
because the professors had to set up the bodies and put little pins, and you had to name structures. So Saturday nights, we spent in the cadaver lab.
Oh my gosh.
Yeah.
See, that's fun. I've only seen like an AP anatomy in high school. This is nothing. We had cats. Like we dissected like the cats. But a human, I'd love to see that. That's so cool.
And these people who they were donated their bodies to science to teach us
Yeah.
were, we had a ceremony for them at the end of the year, and reading a lot about these people that actually shared their story. It's beautiful. Like some of them, one was a teacher,
Yeah.
an elementary school teacher, and she wanted to continue that even after her death, to continue educating us.
See, that's so amazing.
And we had some of the family members of the cadavers come, and these patients who donated their bodies, and we had a really beautiful ceremony. So, these are memories I will never forget about in medical school.
Yeah.
So yeah, that was my favorite subject. And obviously when I got to the hospital surgery, hanging out with the surgeons.
Oh, see, that's amazing. Have you ever had like a patient wake up during surgery?
No, it's funny. Everybody asks me that.
Yeah.
It does not happen.
Okay.
There's an anesthesiologist in the operating room.
Yeah.
They are in charge of keeping you asleep. There's two ways to keep you under general anesthesia. Number one is an inhalation gas. You have a breathing tube while you're asleep, and there's gases that are keeping you asleep. And there's also a way to do it with IVs.
Yeah.
Something called propofol. Bad press. Michael Jackson. That's something that should not have been used at home for Michael Jackson. It should only be done safely in an operating room, but it can also be done through the IV.
Okay.
And actually doing a combination of the both is what most people are using now because it helps with the wake up. You're not as groggy, you're
Okay.
not as nauseous, you're not vomiting. So
Yeah.
my anesthesiologist know what I
Yeah.
like the cocktail, and
Yeah.
patients wait. You're not going to wake up in the middle of like, you know,
Yeah. No, I've always, the only like fear I have during surgery is saying something completely out of pocket when I wake up because I know you're so loopy, like waking up from anesthesia. But like, I don't know. I've like heard stories about people saying the craziest stuff. And I'm
no,
like,
for the most part, people are just like groggy, kind of waking up. Some patients actually wake up kind of like swinging.
oh, that's crazy.
It's interesting.
Yeah.
That's not a majority of them. It's like, every once in a while there'll be a patient just wake up kind of like swinging, and
Yeah.
it's usually kind of like the younger teenagers. Actually, I don't
Yeah.
know why. There's always those kind of patients. For the most part, people wake up very calmly.
Yeah.
Immediately they're responsive, and
Yeah.
we transfer you to the stretcher, take you to the recovery room, and
Yeah.
then that's where you wake up, and that's where you remember me saying,
Yeah,
"Hey,
exactly.
Victoria, we're all
Yes, we're
done."
done. I'm excited to get my nose done. I'm like fiending to go back under the table. I just love transformation. So like I'm
This
just
is I think this is
excited.
the final touch. Other than the veneers, I
Yeah,
think this is it.
exactly. Besides the voice, I might do the voice surgery. Like I don't know what it is. Like they cut my vocal cords or
That is,
something.
you got to be super careful with that, because if something goes wrong, then you'll have a hoarse, raspy voice. Won't be able to, yeah.
Hmm. Maybe
That
I'm
is, you got to be careful with that one.
Yeah.
But they also do like voice coaching and things like that.
I try, but I like see it like already through this interview. I feel like my voice is like went back down because I went not thinking about it. But then when I bring it up, is when I think about it.
So that really concludes our first episode. We had an awesome guest. Thank you for joining us.
Thank you for having me.
And we're going to drop another episode next week.
I'll be watching.
It's going to be just me. And our goal is for patients, they can ask questions. Questions that they're, maybe afraid to ask in person on a consultation. And we can, email us, drop us comments, and we can talk about questions that you may have, but are just too afraid to ask with plastic surgery, whether it's a mommy makeover, breast augmentation, facelift. So we're really excited to get this podcast up and running.
I'm excited.
We're changing Beverly Hills. We're changing the stigma of plastic surgery. So thank you for joining. Thanks for the audience for joining us. And we will see you next week.
Thank you.
Next week, we're going to do another episode and answering your plastic surgery questions. Those questions that are burning. You were a little bit too shy or afraid to ask your surgeon, or just haven't taken the first step in going to your surgeon. We have a safe space. You're here. You can drop a comment below, ask a question, anonymously email us, and I'm here to answer your questions. Safe space. Talk about those myths that people think are true. And just be a very informative, informal session. Have fun. Talk about plastic surgery. We will see you in the next podcast.